Namaste. Myself Jayoti and Gaurav Goyal from the Faculty of Physiotherapy and Diagnostics FPD in the discipline Radiology in the Department of Diagnostic and Community Health in Jayoti Vidyapeeth Women's University Jaipur. So we are going to discuss about an important session that is a particularly beneficial for radiodiagnosis students handling equipment and other related aspect. Okay. In our earlier session, we had discussed about the CT scan component and the working. Now, in this session, we are going to discuss about the different generations of the CT scanner. So, now we are going to discuss about the CT scanner generation. A variety of CT geometries have been developed to acquire the X-ray transmission data for image reconstruction. The geometries are commonly called generations. The main objective of different generations is first one is the scanning time reduction, second one is the simplification of mechanical motion. So now we are going to discuss about the first generation CT scanner. So the first generation CT scanner is a rotate translate type. Means rotate translate type means the X-ray tube is rotating in this type of generation, and the detector is in translate motion, or it uses pencil beam system. Means the beam is in the shape of pencil shape or pointed beam. Okay, it has two X-ray detectors and used parallel ray geometry. Okay, so the rays are generating from the X-ray tube that are emitted in parallel to one another. Okay, so it has two X-ray detectors and used parallel ray geometry with an AI detector, means solid sodium iodide detector. Okay, it took about 4.5 minutes per scan. So in the first CT scanner generation, it takes 4.5 minutes per scan with 1.5 minutes to a reconstruct of light. So it uses 1.5 minutes to reconstruct a light. Okay. Next, there is a large change in signal due to increased X-ray flux. Okay, there is a large change in signal due to increased X-ray flux outside the head. Means the head of the carriage or head of the gantry. Head, and hence patient's head is touched into a flexible membrane surrounded by a water box. Okay, the NI sodium iodide detector signal decayed slowly, affecting measurement. Advantage of the system is efficient scatter reduction. Okay, so in this session, in this first generation of CT scanner, we discussed that X-ray tube, the type of X-ray tube, type of beam, type of motion of the X-ray tube, and the detectors, the number of detectors, and the time it takes for imaging of the scan or reconstruction of light. Okay. Next we are going to discuss about second generation. The second generation, in the second generation CT scanner is also rotate translate type. Means the X-ray tube is rotating in this session or in this the in this type of revision or rotate or translate. Translate means the detectors are in translate motion in the second generation CT scanner. With narrow beam geometry means the beam are narrow. Beam, when the beam is generating from the X-ray tube, it goes in a narrow beam geometry. It uses linear array of 30 detectors, linear array of 30 detectors to acquire more data and improve image quality. Okay, this scanner provides faster scan. Okay, the shorter scan time is 18 seconds per slide. Okay, so it takes 18 seconds per slide. So now the next generation is third generation CT scanner. Okay, it is a rotate system. Means in this type of generation, the X-ray tube and detectors both are in the rotate motion. Okay, both are rotating. It is a rotate system with wide beam geometry. Means when we are generating beam are generating from the X-ray tube, it diverges or it is a in wide beam geometry fashion. Okay, the number of detectors has increased substantially greater than 800 detectors. So number of detectors increased in a great number. Okay, like 800 detectors, and the angle of the beam is increased to cover. Angle of beam is increased to cover entire patient. Okay, it eliminates the need for translation motion. Okay, the X-ray and detectors array are mechanically joined and rotate together. This scanner have less scan time, less than 0.5 seconds. Okay, so it takes very less time in the scan. Next one is the fourth generation CT scanner. The fourth generation scanner are designed to overcome the problem of ring artifact that is in the third generation CT scanner. It has a stationary ring of about 4,800 detectors, and X-ray tube has to move inside the detector. So it is a stationary ring around the X-ray tube. In the ring, 4,800 detectors are arranged, and the X-ray tube has to move inside the detector. Since it is rotate continuously. So it is rotate continuously. Fast scan time is possible. Okay. Next one is geometrical misalignment between the detector ring radius and the X-ray beam origin may be possible. Okay. It has the inter-scan delay time. Okay. In the fourth generation CT scanner, there is a inter-scan delay time. Means in between the two scans there is a delay time. Since the X-ray tube has to return to starting position. Okay, in after every cycle, the X-ray tube has to be rotated, returned to its starting position. In this generation, the individual detector is the apex through the X-ray tube from the fan beam. Data are processed for fan beam reconstruction with each detector as a vertex of the beam. So third generation, in the third generation CT scanner, there is a wide beam geometry. But in the fourth generation, the beam is used as fan shaped beam. Next point is the fifth generation CT scanner. Generation scanner is a stationary system. Means the X-ray tube and detector both are in the stationary system, developed especially for cardiac tomography imaging, CT imaging. Okay, no conventional X-ray tube is used. Instead, large arc of tungsten encircle patient. Large arc of tungsten encircle patient and lies directly opposing the detector ring. Lies directly opposing the detector ring. It uses an electron gun that deflects and focuses a fast-moving electron beam along tungsten target ring in the galaxy. Okay, since the detector is also in the form of ring, it permits simultaneous acquisition of multiple image sections. Okay. Next one is that the images are obtained in 15 milliseconds. It takes a very less time in imaging, 50 millisecond times, and can produce fast frame rate. CT movies of the beating heart with minimum motion artifact. Advantage is fast speed data acquisition. The whole heart can be acquired in 0.2 seconds. The scanner are useful in the case of first one is the cardiac imaging, second one is the pediatric in the case of any child pediatric, and the third one is the trauma patient. So now we are discussing about the sixth generation. So the third or fourth generation it uses slip ring technology and with the helical motion. Okay, and with the helical motion means it is it moves as a helical. Okay, slip ring. Slip ring is a circular contact with sliding brushes and allow the gantry to rotate continuously. Okay. Next one is it eliminates the inertial limitations at the end of each slice and has greater rotational velocity. Okay, with shorter scan time. Helical CT scanner acquires the data while the table is moving. In some instances, the entire scan can be done with brief hold of the patient. Okay. So after studying these six generation, now we are going to discuss about seventh generation CT scanner. Okay. Seventh generation uses multi-detector array. The collimator spacing is wider and more X-ray are used in producing the image data. Okay. It offers flexibility of CT precision protocol. The number of parameters have increased. It has better efficiency for the patient image. Okay. So in this session we have discussed about the different generations according to the minimized scanning time, better image quality. Okay. This session is related to the course hospital administration radiodiagnosis in the BScRT. Okay. In this session, we have already discussed about first, second, third generation. First generation is basic session or rotated jack, and second one is the, also a rotated jack. Third one is the rotate type. So, the third one and the fourth CT scanner is used in nowadays. Okay. So it is the advanced scanner. Thank you. This session is over. This session is powered by Digital Version 2.0. I think you will satisfy this session. If you have any queries, then put it into the comment box. I will resolve it later. Thank you. This session is powered by 2.0 JVWU.